Hello, everybody, and thank you for joining us. As you know, that this is the American Heart Month, and in February, it couldn't be a better time. This is when we think about all things heart. And in addition to thinking about our loved ones, we need to think about our actual heart and how to keep ourselves healthy. So, in the American Heart Month, we also recognize Go Red for Women because during this month, we pay special attention to the circumstances around cardiovascular disease and women. Let me just share a few details with you. On average, someone dies of cardiovascular disease every 36 seconds in the United States. And there's over 2,000 deaths from cardiovascular disease each day. And that's based on 2018 statistics. And those are very sobering numbers, especially when we recognize that many times cardiovascular disease can be prevented or delayed. On average, the first heart attack, which is the most common manifestation of cardiovascular disease, strikes men at about age 65, way too young, and the average age of first heart attack for women around age 72, also way too young. Cardiovascular disease remains the number one killer of women and causes 1 in 3 deaths each year. Now, when we look at African Americans specifically, cardiovascular disease kills around 50,000 African American women annually. So those are the grim statistics, but there are some things that we can do. And one of the things is that we can learn life-saving techniques. And that's in addition to the things that we can do individually, like watching our diet and exercising and being really kind to our heart. But what about if we are in a situation where we see someone who is having a cardiac event? It's a terrifying situation to be in. But isn't it wonderful if we know how that we can assist and know how to assist? So recently, I had the opportunity to participate in a CPR presentation with Kiara Landin. She's from the American Heart Association. So let's just take a minute and watch that video, watch and learn, and then we'll come back and answer some questions and learn more about what we can do in case of an emergency. Take a look at the video.
Hi, Mrs. Bush. So happy to be here today with Authority Health. Happy Heart Month.
Yes.
I'm excited. Yeah, this is a great day to learn how to save a life. So we're going to go over hands-only CPR today. It's a very brief, simple training. The CPR Anytime kit that you received includes a CPR mannequin, which you have right in front of you. It includes a sanitation wipe to keep that clean. And an instructional DVD that goes through the entire training. Now, for today's sake, we're going to stick to hands-only CPR. And for the first portion of this training, we just focus on compressions and how to do proper compressions. And then we'll talk about the steps leading up to those compressions and what that looks like in real life when we come across someone who's experiencing cardiac arrest. Does that sound good?
It sounds wonderful. I'm looking forward to learning about it today.
Awesome. And I almost forgot to introduce myself. So I'm Kiara Landin. I'm the Community CPR Manager for the American Heart Association. And this is what I do. Quite often, I host trainings. I provide resources to underserved communities, specifically CPR resources. So let's get to it.
Let's do it. And Kiara, I just want to thank you for doing this today. You know, this is so important. And you mentioned, especially in under-resourced communities, you know, we definitely want everybody to know how to save a life if they're in a situation where someone needs it. So I'm ready to get started.
Awesome. Okay, so I'm going to angle my camera a little bit so that you're able to see my mannequin. So, you know, in this work from home life, we got to adjust.
We do, that's right.
So first step with compressions, a couple of things to remember. So you'll want to do compressions. You'll want to push hard and fast. You'll want to push from 1.5 to 2 inches deep. So another things to remember, you'll want to do those compressions 2 fingers above the bottom of the sternum, so the center of the chest, in between the nipples. So you'll take your dominant hand out, take the other and wrap it around the other hand. So
Dominant hand out. Are my fingers going towards the nipples or towards the neck?
So before we get there, so you'll want to put the palm of your hand in the center of the chest, in between the nipples.
Okay.
Okay, and it'll be about 2 inches above the bottom of the sternum. So
Got it.
So you'll take your dominant hand out, lap the other hand over, and you'll want to push hard and fast. So sorry, you can't hear that, but our mannequins provide audible feedback. If you can't hear the click today, that's okay. Just go through the motions. So dominant hand out, lap over, center of the chest, and then push hard and fast. So you'll want to keep your elbows straight so that you don't get as tired.
Yes.
But it is a workout.
It is a workout.
That's all you got to remember, hard and fast. And we mainly focus on just the compressions because their hands-only CPR is just as effective as CPR with breaths, if not more, because that removes that intimacy barrier. And especially now with the pandemic, we want to keep people safe. If you are in the home, which is where cardiac arrest happens the most, you're already exposed to those people. So you don't have to worry about face coverings or anything of that nature. Just remember the 2 steps, the hands-only CPR is first, calling 911, and second, doing those chest compressions, pushing hard and fast.
Let me ask you a question. Is there any tricks that you use so that you know how fast to go? Like at one point we were talking about like singing a song. When I was taught years ago, we were singing staying alive, ooh, 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 ooh. You remember that song?
Yep, I certainly do. And we still use that song for trainings. So I had it on my phone. So we recommend, again, doing those compressions 100 to 120 beats per minute. So using a song like Staying Alive will keep you to the beat. So
okay. Well, that's good to know that that's still the song. That's the song I taught my children when they were young to just keep going at it. But it is a workout, guys.
Yep.
Yep. You know what? It seems like then the more people around who know how to do this, sometimes do people trade off and I can start, and if there's someone else who knows, keep going, because I think it's important for us to keep doing it until help arrives, right?
Yes, so I'm so glad you brought that up. Let's talk about what this looks like leading up to the chest compressions. So if you find someone unconscious, you first want to assess the scene, make sure you're in a safe area. If you are not alone, definitely, first step is calling 911. If you are not alone, you'll tell someone, you go call 911 and say it like you mean it.
Yes.
And then begin those chest compressions. Now, again, if you're not alone, you'll want to have another person and you'll say, you watch what I'm doing, because you will get tired. I'm out of breath already.
So am I. Okay, I'm glad you said that because I was ready to sit down and rest.
Yep. So you'll want to, again, if you're not alone, you'll have someone call 911 first, have your location set and ready to go for EMS to arrive. You'll start those chest compressions right away. Again, if you're not alone, you'll have someone else watch what you're doing because you'll want to do those chest compressions until EMS arrives. Okay. Or at least until an AED arrives. So let me walk you through what that looks like on the mannequin.
All right.
So we come to the scene, person is unconscious. You'll want to tap them, shout their name. Are you okay? Are you okay? No response. First, call 911. Stay on the phone until you're told otherwise. If someone is near you, you say, you, watch what I'm doing, and start those chest compressions. Hard and fast. Ha, 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 ha. Staying alive, staying alive.
Oh, I hear your clicks.
Yep, and that's how you know you're pressing hard enough. So center of the chest, in between the nipples, at 100 to 120 beats per minute. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, until EMS arrives. How do you feel?
You know what? I'm feeling worn out and I didn't hear a click on my end. So I have to say that your mannequin is much more fortunate than mine at this point. I just need more practice though.
No problem at all. The important thing is to take action no matter what. We always say any CPR is better than no CPR. I often get questions like, can we hurt them? What if I break a rib? If you break a rib, you're doing it correctly. You can mend a broken rib. You can't mend the situation if you don't do anything. The person will die.
Yeah.
So critical for us to know what to do. Just remember, call 911 first and foremost and start those chest compressions.
I have a question, and I know you've heard this question before. So what about the Good Samaritan rules? So say, for instance, I have come on the scene and I've now done CPR and I've broken a rib and the person survives and now wants to sue me. So I know anybody can sue for anything, but I don't want to not help for fear of being sued. What can you share about that?
That's a great question. So most states have a Good Samaritan law. It varies so every state has the Good Samaritan law. It varies what's under the law by state. However, in that law, regardless, nationwide, it says you will not get any kind of, you won't get sued essentially if you act prudently and quickly. So basically, it protects you as long as you have good intentions, as long as the intention is to save that life and you're taking action, do not worry about getting sued. There's actually more liability nowadays if you don't do anything at all. So keep that in mind.
That is good to know. Now, when you were showing us about when we can come on the scene, we shake them and ask, can you hear me? And if they're non-responsive, do we have to check and see whether or not they're breathing, or it doesn't matter? When is CPR appropriate? If I'm unconscious but still breathing, do I do this, or only after you've determined that the person is not breathing?
So after shaking them, and that includes checking if they're breathing, if you have time to check the pulse, but if you already can tell that they are not breathing, there's no pulse, there's no signs of life, again, first step is call 911.
Yep.
Let them know exactly where you're at and start those chest compressions. If the person is breathing, they're unresponsive, again, first 911 first and foremost. However, if they are breathing, if there's a pulse, that is where 911 will guide you sometimes whether they will need CPR or not. So there is telephone CPR that EMS can provide and walk you through the motions. But in a nutshell, if they are completely unconscious, no breathing, no pulse, start those chest compressions. But always remember, it's 911 first and then chest compressions.
Very good. And if you're not sure, if you haven't had time you've called 911, you may not know how to check for the pulse, but start the compressions until 911 tells you otherwise, or until help comes.
So first call 911. If there are signs of life, if they are breathing, hold off until after you've called 911. Got
it. All right. Well, I always like to get into the details, and you have certainly helped us do this today. I really want to thank you. We know that this is Heart Health Month. It's Go Red for women, but we want people to make sure that they feel comfortable stepping in and assisting in these life-threatening situations. I know I, for one, am very glad that you have taught us about hands only, so that people are more likely to step in. You've also taught us that in most states, probably all states, we're protected by the Good Samaritan law. So if we get in there and start with good intentions, if something goes wrong, that shouldn't be, over the overriding thought. The thought should be to step in and save the life. But you have said it time and time again. First, call 911 and then get started with those chest compressions. So before we go, can you give us a website or a phone number where we can go for more information on heart disease or on CPR?
For sure. So everyone can access CPR information, whether that's community hands-only CPR or certification at cpr.heart.org. I just want to say thank you for having us. Our mission again is to have as many people know the basics. With Heart Month, right here, right now, our focus is also on reminding people that women are less likely to receive CPR than men, yet women are more likely to act in an emergency. So this is a reminder to all the males out there. Performing CPR in women is crucial. Regardless of the anatomy, it's the same. You still call 911 and you start those chest compressions. So just wanted to throw that in there. It is crucial. The number one killer of women is cardiovascular health. So we need everyone to, not hesitate and take action.
Thank you so much. Thank you for spending this time with us. The American Heart Association is a great partner with Authority Health. You're always there when we call, and we appreciate you. Thank you for spending this time with us.
No problem. Have a great one.
You too.
Well, thank you, Kiara, and the American Heart Association. This is a situation that many of us really don't ever want to think about or find ourselves in. But isn't it better when we know that if we should come across this type of situation, we know how to help? And we want to just encourage you to learn more and don't hesitate if there's an emergency situation to first call 911 and then to start the chest compressions. Now, I know that there are other questions out there, so let's get to those. There's questions, and we also have Authority Health physicians on this call so that they can answer the questions. So our first question is actually from Corliss. Corliss, what's your question?
Thank you. How does heart disease affect women?
Well, chest pain is the most common symptom in men and women who are having a heart attack. Heart disease can affect women differently than men. Women can present with discomfort and pain in their arms, necks, and jaws. And unlike men, women usually present with other symptoms such as nausea and shortness of breath.
Thank you.
Thank you. Thank you, Dr. Shigir. I think we have a question now from Pat.
Thank you. What are the risk factors for heart disease?
Thanks for asking, Pat. The risk factors for heart disease include male gender, family history of heart disease, age greater than 50 years, prior history of heart attacks, smoking, atherosclerosis, hyperlipidemia, obesity, lack of physical activity, and diabetes. Diabetes is the strongest independent risk factor for heart disease in both men and women. Because African Americans are more prone to hypertension and diabetes, they are more likely to suffer the cardiovascular effects from these conditions. These effects include coronary disease resulting in heart attacks and congestive heart failure.
Thank you.
Thank you, Dr. Yoder. Very important information for us to know. All right, I believe Jeanette has a question.
Thank you. How does genetic factors affect a person's heart health?
Thanks, Jeanette. Family members can pass on genes for high cholesterol, obesity, and diabetes to one another. And all these heritable conditions predispose someone to heart disease. Heart disease in parents and siblings indicates an elevated risk of heart disease.
All right. I think our next question is from Brandy.
Thank you. Does diet and exercise help reduce the risk of heart disease?
Thanks, Brandy. This is a great question. Yes, as a matter of fact, healthy diet and exercise can help reduce the risk of heart disease. A diet low in saturated fats, cholesterol, and sugars or starches can help lower one's risk for heart disease. Regular physical activity that results in weight loss and improved fitness can also lower one's risk for heart disease.
Great. Important information to know. Leslie, do you have a question?
I do. My question is, how does COVID-19 affect the heart?
Thanks for that question, Leslie. It's a really pertinent one, especially right now. So COVID-19 affects the heart through both a direct and indirect mechanism. COVID-19 attacks the lung tissue, and as a result, the heart has to work harder to pump oxygenated blood through the body. This can strain the heart and lead to something called demand ischemia. Hospitalized patients with COVID-19 may usually have elevated cardiac enzyme levels as a result of the heart being overworked. In some patients, COVID-19 causes inflammation in the arteries, bringing blood and oxygen to the heart. In many, and it may cause a heart attack. In some cases, COVID-19 causes inflammation of the heart muscles, myocarditis, causing the heart to pump less blood.
Great. Thank you, Dr. Shiger. And I think we have time for one last question. And that last question is going to come from Lee.
Thank you. What is the difference in performing CPR on women versus men?
Thanks, Lee. There's essentially no difference in performing CPR in men or women. CPR should be performed at a depth of about 1.5 to 2 inches and a rate of 100 to 120 compressions per minute. However, when it comes to the rate of CPR being performed on men versus women, studies have shown that people are less likely to perform CPR on women versus men because of the perceived fear of hurting the woman.
All right. Well, that's the last question. Thank you, Dr. Shiger. Thank you, Dr. Yoder. Thank you, everyone, for participating and for giving us your questions. As in closing, I'd just like to say on behalf of Authority Health, I'd like to acknowledge and thank our partners at the American Heart Association. I'm going to start with Kristen Hurley, who is the Executive Director. I'd also like to thank Michael Randall, who is the Director of Community Impact, and of course, Kiara Landin, the Community CPR Manager, who walked us through that excellent demonstration. So in closing, I always like to say, knowledge is power. And in this month, when we focus on all things health, please make sure that you understand about heart health and what you can do to prevent heart disease, to keep yourself healthy, but also to be able to act in case of an emergency. Have a great day.